Good afternoon, and thank you for joining our daily briefing on the City of Philadelphia's response to COVID-19. Today, all speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing now with opening remarks from the mayor. Mayor, you now have the floor.
Thank you very much. Good afternoon, everyone. And I start today with some welcome news. The city has reached agreement with 2 additional hotels for quarantine and isolation space. This is in addition to the use of the Holiday Inn Express in Center City that we previously announced. The other sites are the Fairfield Inn and Suites by Marriott in Center City and the Marriott Spring Hill Suites at the Philadelphia International Airport. The 2 additional sites will be used for first responders who need quarantine or isolation space. The Holiday Inn Express, which currently has 40 occupants, is for anyone who cannot quarantine or isolate at home, including first responders and individuals who are homeless. I really want to thank the owners and operators of these sites for stepping up the way they have. At the Fairfield Inn, General Manager Jim Lawrence Evans and the entire Wankawala organization deserve the city's thanks. And Marriott Spring Hill Suites owner Charlene Schwartz and the General Manager Jen Lampkin are owed gratitude as well. Along with Bill McNamara and the McNamara family at the Holiday Inn, all these folks deserve the thanks of every Philadelphian for their willingness to provide their facilities for this important need. And thanks as well to Fire Commissioner Adam Teal and the terrific staff at our Office of Emergency Management for their hard work in reaching these agreements and standing up these sites so our first responders and residents can get the care that they need. We know that COVID-19 adds another layer of uncertainty for many of our citizens who may need special care and support, especially older adults and infants. Today, we are pleased to announce that in partnership with the Philadelphia Corporation for Aging, we are able to offer 23 meal sites that offer grab-and-go meals for older adults. Family members are able to pick up the meals for the seniors also. You can find that list at phila.gov/COVID-19. That's phila.gov/COVID-19. Older adults should call each site first to be added to the list for meals or to discuss other meal arrangements. Our youngest citizens also need support at this time. Today, we are pleased to share that there are now 10 locations throughout the city where caregivers of infants and toddlers can pick up free baby supplies, including diapers. Caregivers are encouraged to call ahead to make sure the appropriate diaper size is available. A full list of sites and resources is available on phila.gov/COVID-19. phila.gov/COVID-19. In addition, free virtual breastfeeding support is also available through pacify-.com with enrollment code Philly, Philly. That's pacify-.com with enrollment code Philly. I want to say huge thanks to Deputy Mayor Cynthia Figueroa and Deputy Managing Director Eva Gladstein for leading the work to bring these resources to babies, their parents, and to our older citizens. Thanks also to many staff who made it happen, including the Mayor's Commission on Aging, led by Nora Dowd Eisenhower and Stacy Callum from the Philadelphia Department of Health. Now I will turn it over to Dr. Farley for his daily update.
Good afternoon. The news on the epidemic is mixed today. We're seeing a stabilizing of the daily count of cases and in deaths, but it's unclear whether we're getting all the laboratory reports we need to get in. And we are seeing increasing numbers of cases of people with this infection in hospitals. So here are more details. Since yesterday, there have been 311 new cases of the coronavirus infection reported to us at the health department in Philadelphia residents, bringing us to a total of 7,441 cases since the beginning of the epidemic. Now that 311 count is lower than we had before, but again, we're seeing a lower number of laboratory reports than we expected. So that daily count may be falsely low. And we're checking with the laboratories to see if there's some problem with the data feed that we're getting. If you want more breakdowns of that case count by age, race, and sex, they're on our website. We're continuing to work with a number of congregate facilities around the city, around clusters of infection in those facilities, including the city's jail. The city's jail currently has 56 inmates who are positive. That includes 3 new patients or inmates who tested positive since yesterday and 1 other who's recovered. The number of cases of this infection, people with this infection in hospitals, has been growing. Right now in the city, there's 778 people with this infection in city hospitals. And across the whole Southeast Pennsylvania region, it's 1,428. Both those numbers are higher than they were yesterday. Now, region-wide, we have plenty of availability in hospitals. 42% of our hospital beds are available, and 27% of our intensive care unit beds are available. But some hospitals in the region have been hit harder than others, and some of them are near capacity, especially for intensive care unit beds. So many of these hospitals, or some of these hospitals, may need to be transferring patients to other hospitals or diverting patients to other hospitals so that they can pick up the available beds elsewhere. I have to report, sadly, that there are 16 new people who have died of the coronavirus infection since yesterday, bringing us to a total of 222 deaths since the beginning of the epidemic. Now, that number of daily deaths is lower than we saw last week. We're repeating more than 30 deaths in a single day. We want the number to obviously to continue to get lower. Of the 222 total deaths, 111, or just 50%, have been in nursing home residents. And more demographics of the people who've died are on our website. Let me talk for a minute about testing. We know that there's a lot of interest in testing in residents across the city. We are still limited in the number of tests that we can do. We're limited by the number of swabs that are available to collect the sample. We're limited by the number of tests that a laboratory can do. Laboratories need chemicals called reagents in order to run these tests, and there are only so many reagents available. And we're limited by the fact that the largest laboratories have pretty severe delays in reporting. It takes 5 or 6 days to get an answer back. This is happening now, even though we've been in this about 5 weeks. And so it's frustrating for all of us. However, testing is still available for people who are most at risk. And if you want to have a test and you think you're appropriate, just go to our website, phila.gov/COVID, and there's links and phone numbers for all the different sites around the city where testing is available. We're recommending it for healthcare workers with symptoms or for people over the age of 50 with symptoms that are characteristic of the coronavirus infection. Now, just speaking to everyone across the city, whether you feel like you have symptoms or not, the hospital data says that we're not necessarily past the worst of this yet. I'm hopeful that we're near the top, but we're maybe not past the worst of it. People are still getting sick, and we know the virus is still circulating. So just remind people again, if we start behaving as we did before, this virus will surge again, and our hospitals will have more difficulty dealing with people who become sick. So I know for those of you who've been cooped up inside for weeks now, it's difficult to stay inside. Your household members may be getting on your nerves. You really want to get out and do things, but please, the best thing for you to do, best for you, best for your family, best for Philadelphia overall, is to stay inside. If you have to go outside, go to the grocery store, or you're an essential worker, keep your distance from people and wear a mask. The website again, www.phila.gov/COVID, or if you have medical questions, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We will now move to Armando, who will give our Spanish translation.
Henry para el miércoles 15 de abril del 2020. Buenas tardes a todos. Comienzo hoy con buenas noticias. La ciudad ha llegado a acuerdos con 2 hoteles adicionales para contar con espacios para aislamiento y cuarentena. Estos locales se suman al Holiday Inn Express en el centro de la ciudad que habíamos anunciado anteriormente. Los hoteles son el Fairfield Inn and Suites by Marriott en el centro de Filadelfia y el Marriott Spring Hill Suites en el Aeropuerto Internacional de Filadelfia. Estos hoteles se utilizarán para alojar a los socorristas que necesiten espacio para aislamiento o cuarentena. El Holiday Inn Express, que actualmente alberga 40 personas, es para cualquier persona que no pueda permanecer en cuarentena o aislarse en su hogar. Esto incluye a los socorristas y a las personas sin hogar. La ciudad de Filadelfia agradece a todos los operadores y propietarios de estos hoteles por su apoyo. Muchas gracias también al gerente general del Fairfield Inn, Jim Lawrence Evans, y a toda la organización Huancawala. Infinitas gracias para la propietaria del Marriott Springfield Suites, Charlene Schwartz, y a su gerente general, Jen Lampkin. Gracias a Bill McNamara y a la familia McNamara del Holiday Inn. Todas estas personas merecen el agradecimiento de los residentes de Filadelfia por su disposición a proporcionar sus instalaciones. Mil gracias van al comisionado de bomberos Adam Thiel y al personal de nuestra oficina de manejo de emergencias por su arduo trabajo para lograr estos acuerdos y por habilitar estos espacios para que nuestros socorristas y residentes puedan obtener la atención que necesitan. Sabemos que la crisis de salud por el COVID-19 le agrega más incertidumbre a muchos de nuestros ciudadanos en necesidad de atención especial, especialmente a los adultos mayores y a las familias con bebés. Hoy nos complace anunciar que junto con la PCA, Philadelphia Corporation for Aging, podemos ofrecer 23 centros de comida para llevar para los adultos mayores. Puede encontrar esta lista en phila.gov/COVID-19. Los adultos mayores deben llamar primero a cada centro antes de buscar las comidas para poder registrarlos en el sistema. Nuestros residentes más jóvenes también necesitan apoyo en estos momentos. Hoy nos complace informar que ahora hay 10 centros en toda la ciudad donde los padres y los representantes de bebés y niños menores pueden recoger suministros gratuitos, entre ellos pañales. Se recomienda a los padres y representantes llamar con antelación a los centros para asegurarse que tengan la talla de pañales adecuada para su niño. Hay una lista completa de los centros y los recursos disponibles en phila.gov/COVID-19. Además, quisiera recordar que hay apoyo gratuito y virtual para la lactancia materna en pacify.com con el código de inscripción Philly. Quiero agradecer enormemente a la vicealcaldesa Cintia Figueroa y a la subdirectora general Eva Glanstein por su liderazgo y por llevar estos recursos a los bebés, a sus padres y a los adultos mayores. Muchas gracias a todas las personas que han hecho esto posible. La Mayor's Commission on Aging, dirigida por Nora Dowd Eisenhower, y Stacy Callan, del Departamento de Salud de Filadelfia. Y esta es la actualización en materia de salud al 15 de abril del 2020. Desde ayer se han confirmado 311 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 7,441 casos en la ciudad. El recuento de estos casos diarios ha bajado, pero probablemente esto se deba a que no todos los laboratorios han informado de sus resultados. La ciudad está monitoreando de cerca esta información. Tenemos 3 casos positivos de COVID-19 en internos, con un total de 56 casos registrados. Los hospitales están monitoreando el crecimiento de los casos. En total, hay 778 pacientes que están hospitalizados en Filadelfia y 1,428 en la región sureste de Pensilvania. Reportamos 16 nuevos fallecimientos en Filadelfia. Hay un total de 222 personas que han muerto por la COVID-19. 111 de estas muertes se han producido en hogares de ancianos, porque este virus no discrimina ni por raza ni por género. Las pruebas están disponibles, pero son limitadas. Hay retraso en el informe de casos positivos. Usted puede encontrar mayor información sobre los centros de pruebas en phila.gov/COVID-19 bajo la pestaña FAQ. Los datos obtenidos de los hospitales nos indican que no hemos pasado todavía la peor parte de esta crisis sanitaria. Tenemos que observar las medidas de permanecer en casa para poder estar seguros, porque el virus sigue circulando en nuestro ambiente. Si no respetamos la orden de permanecer en casa, el virus se propagará rápidamente. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos, utilizar máscaras de tela en lugares públicos donde observar las medidas de distanciamiento social sea difícil de lograr. Le invitamos a consultar el sitio web para mayor información, www.phila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponibles en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas del día, los 7 días por semana, al 1-800-722-7112 y esta llamada es gratuita. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. I would like to ask all of our speakers to again join us with your audio and video. Please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted. Reporters are asked to limit their questions to 3 or fewer. We'll definitely do a second round if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We will unmute your questions one by one, and please turn on your video to ask your questions if possible. First, we will go to Jeff Cole of Fox 29. Jeff?
Yeah, good afternoon. Question for Dr. Farley. Dr. Farley, at hospitals across the region today and into the evening, Temple, Einstein, Jeans, Crozier out here in Delaware County, unionized nurses will come out in front of these hospitals and plead once again for PPE. We've interviewed some of them today, and they've said that they know their colleagues have tested positive for COVID-19 because they simply do not have the protective gear. Commissioner, who's responsible for that? And what's the situation in the city? And what about your efforts to try to obtain this?
So personal protective equipment is in short supply across the city and across the country. And so we have provided guidance to hospitals following the CDC's guidance on how to conserve personal protective equipment. If they threw it out every time they used it for each individual patient, then we wouldn't have any for the people that need it. So we are using PPE conserving techniques. That means the PPE is limited. However, it is available for workers. Now, I can't say the specifics about any individual hospital or specifics of their complaints, but I can say that the system-wide, we are under limits, but it's able to get by.
Commissioner, do you think, though, that the shortage has endangered healthcare workers, as they're alleging that they've contracted it as a result of not being protected?
Well, we know that healthcare workers with this infection across the world are at higher risk. Healthcare workers have been infected across the world and across the city. The personal protective equipment can greatly reduce that risk. It's probably impossible to eliminate that risk. We think that there is sufficient supply for them to protect themselves, but we certainly have had cases in healthcare workers.
Where's the responsibility lie for the lack of PPE in the face of a pandemic, Commissioner?
So, there's a shortage of PPE around the world. Most of the PPE, my understanding, is made in China. For a long time, China was shut down. We weren't getting anything from China, so there's a shortage across the entire system. The city has been trying to find PPE all over the world, has been working very hard to source it. We have been able to bring in some. We've gotten some from the national stockpile. We're distributing everything we have to healthcare facilities, with hospitals and nursing homes being first. So doing everything we can to supply people, protect people as much as possible. But again, this is a national and global problem.
Well, let me say part of the problem, however, is if you've heard from all the governors, especially Governor Cuomo, who does a very clear message every day, that because the federal government didn't do what they were supposed to do to stockpile it properly, a lot of it's in China. We start trying to accumulate it or to get it, and we wind up getting outbid by the federal government, who's now trying to fill up their stockpile, or through other states and governments that are also out there bidding for it. So if the federal government had done a better job in stockpiling the PPE, it would have been distributed uniformly, and we wouldn't have this mad race to try to find this stuff.
Very good. Thank you. Thanks, Mayor.
Okay, thank you, Jeff. Next, we will go to Maggie Kent with 6 ABC. Maggie?
Hey there. My question is for Dr. Farley. We've been seeing throughout some of the large cities across the U.S. that people who were suffering from COVID-19 were recovering at home, but we've also seen throughout those large cities spikes in people dying at home. Do we have any numbers about the numbers of deaths from COVID-19 at home?
I don't have an updated number. We looked at it a few days ago, and I believe we were at 4 people who had died at home. So the large majority of people are dying in hospitals.
And you mentioned today that you're seeing more hospitalizations are up?
Number of people in hospitals is up. Because, first of all, people, by the time they need to go to a hospital, have usually been sick for a while. And then they stay for a while in the hospital, so that the peak of hospitalizations is going to be later than the peak for the number of new cases in those cities.
Do you have a timeline about when you guys are forecasting that peak of hospitalizations?
Sometime around now, but it's very hard to predict what's going to happen. If the virus spreads more than we think it's spreading, we may continue to see increases for a while.
Okay, thank you.
Thanks, Maggie. Next, we are going to Sean Walsh of the Inquirer. Sean?
Hi, thanks very much. Could you give us an update on the police citation enforcement as it relates to the stay-at-home order, have any been issued? Have they been effective? What's the update there?
I can't speak. I actually think we responded to the Inquirer in writing about this issue. So I'll need to refer back to that.
Okay, gotcha. We have a lot of people working on the same stories. Sorry about that. And then you already touched on the PPEs, I believe, but is there hope that we're going to get more soon? Is there any update that, progress is being made, or is it status quo that we're in line?
No, we're continuing to source PPE from multiple sources. I think I referenced that we have been able to bring in some N95 masks as well as some surgical masks. We're going to continue to do that. I hadn't been prepared to provide daily updates on our stockpiles, but if we need to do that, I think I can revisit that.
Oh, okay. That might be helpful. That's all I have. Thanks very much.
Okay, thank you, Sean. Next, we are going to go to Shaira Arias with Telemundo. Shaira?
Hi, perfect, you can hear me. Armando, so la primera pregunta es, debido a la barrera del idioma y el hecho que muchas personas tal vez no tienen un médico de cabecera, y el hecho de que, según ustedes, es posible que no todos los hispanos se están examinando, ¿hay una posibilidad de que van a hacer que este examen sea más accesible a la comunidad hispana o que sean más flexibles en el hecho, por lo que te menciono de lo del médico de cabecera?
Due to the language barrier and the possibility that some Hispanics would not have access to a primary care physician, this testing may be limited to that community. Is there any plans on making testing more accessible or more flexible to reach this community?
As I said, the testing is limited citywide. There's a limit on the swabs and the laboratory testing capacity. However, there are sites where people can be tested. Doesn't matter what race or ethnicity or what age, what gender, people can be tested. If you go to our website, you can get that information as to where anyone can be tested.
Como he dicho anteriormente, la capacidad de hacer pruebas es limitada en cuanto a que hay recursos y insumos limitados, pero no se hace ninguna discriminación en cuanto a género, raza o etnia, y la información está disponible en los sitios web que hemos hecho disponibles.
El presidente Trump anunció que para la ayuda económica hacia la Organización Mundial de la Salud, ¿piensa que esta es una buena decisión durante esta crisis de coronavirus en donde se está tratando de encontrar una cura? ¿Por qué o por qué no?
President Trump announced that the financial aid to the World Health Organization would be stopped. Do you think this is a good decision given that we have the coronavirus crisis at this time when they're trying to find a cure? Why or why not?
Well, I'll start off. Why you would pick this particular time in history with this pandemic to reduce resources to an organization that has the ability to globalize this whole discussion relative to data and testing and perhaps vaccine. I can't explain what goes on between his ears, but it's a bad thing.
Quiero comenzar.
Doc, do you have any?
I think it's a terrible decision. We need the World Health Organization more than ever right now.
Quiero empezar diciendo de que por qué se ha escogido este momento para hacer esta reducción de los recursos en una asociación que puede globalizar la conversación sobre el tema, la recolección de datos, las pruebas y finalmente una vacuna. No sé qué está pasando por la cabeza del presidente y creemos de que es una terrible decisión en este momento.
Dr. Farley, también quiero preguntar que si me puede hablar un poco más sobre los exámenes que se llevaron a cabo durante el fin de semana. Él mencionó que parece que había una disminución de números, pero realmente no entendí muy bien qué era lo que él estaba tratando de decir. Entonces, si pudiera como explicar un poco sobre si es que disminuyeron las personas que se fueron a examinar o se están tardando mucho tiempo para dar esos resultados y cuál es la situación con los exámenes que se llevaron a cabo este fin de semana.
Dr. Farley, this question is for you. You mentioned that there had been a lower amount of numbers this weekend that were reported, and I would like for you to explain a bit further about it. If this means that there's less number of people that went to get tested, or there was a time lag in reporting results. Can you please explain about these figures over the weekend?
Both of those. So some sites do not offer testing over the weekend. In addition, some laboratories do not provide us data over the weekend. And so our numbers that we have to report over the weekend tend to be lower. And in previous weeks, we have caught up when that backlog is cleared on Monday and Tuesday. Now, this week, for some reason, in the early part of this week, we have not seen an increase in the number of reports. And so we're worried that there may be some, we're not getting complete information from the laboratories, and we hope to clear that up in the next day or so.
Ambos razones explican esto. Por un lado, hay ciertos sitios que no hacen pruebas durante el fin de semana, y por otro lado, los resultados que reportan los laboratorios no se dan el fin de semana. Por lo tanto, normalmente hemos visto que las cifras se ponen al día en los días lunes o martes para incluir lo que sucedió el fin de semana. Pero por algún motivo no hemos visto que haya subido estas cifras todavía, pero no tenemos un conteo total en estos momentos.
Thank you. Gracias, Armando.
Thank you.
Thanks, Shaira. Now we are going to go to Brian McCrone with NBC 10. Brian?
Hello, thanks everyone. Could you do me a favor and go back over and just list out on top of what you already listed out, but also just the overall overflow capacity hotels, and I guess the Leah Corus Center still is on. Could you just list out all of the overflow places that are operating or could be operating? And then I had a follow-up question after that.
I'll go back to my original statement. Where the city reached agreement with 2 additional hotels for quarantine and isolation. The Holiday Inn Express in Center, in addition to the Holiday Inn Express in Center City. Those 2 new ones are Fairfield Inn and Suites by Marriott in Center City and the Marriott Spring Hill Suites at the Philadelphia International Airport. The 2 additional sites will be used for first responders who need quarantine or isolation. There are 40 people at the Holiday Inn Express, including first responders and some individuals who are homeless.
Okay, so you have those 3. And then I just want to make sure that there's also, so the Leah Corus Center, is that operating?
It's ready.
It's ready. Okay. Okay.
I guess tomorrow.
Okay. So is there a number capacity-wise that if you combine all of that together that you could possibly use? And then on top of that, knock on wood, but it seems like at 40 right now, those 40 individuals are first responders. So are there any overflow that's not first responders right now or homeless that are in those facilities? And do you see at a point when these might really hit higher up now than they are now? I'm just trying to figure out where we, is it any prediction to get worse than it is now?
Brian, do you want to handle numbers?
Yeah, sure. So we have 40 people within the Holiday Inn. Some of those are unsheltered. Some of them aren't unsheltered. I don't know what that specific breakdown is. It's more of a general population site. And then 6 first responders that are currently at the Fairfield. We have significant capacity right now, and I think we are comfortable with where we are. But I don't think any of us can predict the future. And I think there's also a recognition that we're going to need additional quarantine and isolation space for some time into the future, even as we move into whatever the next phase of this pandemic is. We will still need to test individuals, rapidly identify those who have been exposed to the virus, and make sure they're quarantined, and if they test positive, isolated. So I think, do we have enough capacity? I think optimistically, we think so. But, we are working with a couple of other hotels as a just in case. which we have not signed leases with, but certainly want to have teed up in case we need additional capacity going forward. The Leah Core Center has 180 beds right now. It does have the ability to expand if needed. And certainly we've made provisions for additional sites should that site get complete to become full. We don't expect that to happen right now, but I think our job is to make sure that we're ready for the unexpected.
Okay. One more quick clarification. The 3 hotels are for the Leah Core Center is going to be for overflow of non-coronavirus. And then, is there a difference now with the hotels versus Leah Core if it reaches that point?
So the hotels are primarily quarantine and isolation space, meaning they're there. They provide very minimal medical support. They don't have doctors or nurses on site. The Leah Core Center does. The Leah Core Center is a hospital. For all intents and purposes, it will accept COVID-19 patients if we get to that point. And these will be step-down patients, so patients that no longer need to have acute care but still need care will be provided at the Leah Core Center with trained doctors and nurses and other professionals. And that is almost completely set up and should be ready to accept patients tomorrow if needed.
Okay. Thank you very much.
Thank you, Brian. We're now going to go to Jack Topsick with Metro. Jack?
Yes. My first question was, why do first responders need a separate quarantine space? It seems like a lot of people are quarantining at home. So what was the need for this separate space for them?
I think we've identified the fact that our first responders are higher risk, and first responders also include doctors and nurses. Most of our hospital systems are taking those first responders and quarantining them where they feel appropriate. And certainly if our first responders are becoming into contact with patients on the job, we want to protect their families as well. These are men and women who put their lives on the lines for us every day. And we want to make sure that we are providing for both them and their families as we go forward.
Yeah, and one more follow-up on that is that I wanted to see if you could lay out who are the first responders. So would sanitation workers qualify as that, SEPTA workers, or is it just the traditional first responders?
So we're saying our first responders are those individuals who are working with the public on a daily basis. So that would be our police officers, our firefighters, our medical professionals. We certainly recognize that we have a number of other essential workers at work, whether that's our sanitation workers, whether that's our security guards, or some of our low-wage maintenance workers. While we're not including them in this. In that definition, we think they're the risk of they are not, as an example, transporting patients, but we certainly recognize everything that they're doing and are trying to provide as many supports as we can.
And for Dr. Farley, you spoke about the delay in receiving results or some type of problem from the labs. Is that hurting your ability to track the epidemic in Philadelphia?
We certainly would like to get the information quicker. The more quickly we can get the information, the better we can make intelligent decisions based on that information. Now, delay in reporting to us from once the lab has put it into their database is only one of the delays. There's also a delay before people develop symptoms after exposure, and there's a delay before they seek testing, and there's a delay in getting the testing done in another 6 days. So all those delays make it so that we need to try to take an action based on what we think is happening, based on what we know. And the shorter we can make those delays, the better our decision making will be.
Jack, are you good? Okay. Now we are going to go to Paige Gross with Technically Philly. Paige?
Hi there. My question is for Mayor Kenny. We've seen some information over the last couple of days about Pennsylvania joining this task force with other states in the Northeast, New York, Connecticut, Delaware, to kind of reopen the economy when that time comes. What is Philadelphia's role in this? Do Philly officials kind of get to throw their ideas into the ring? Are you having meetings with the governor, et cetera?
I spoke to the governor after the announcement of the coalition. and expressed to him, and he readily agreed that we would, because Philadelphia is unique to the rest of the state as far as population and density, that we would have input with him. He also said that it's kind of like, even though these states are all together, it's almost like regional subsets. We'd have a subset of Southern New Jersey, Delaware, and Southeastern Pennsylvania, because they have more like issues together. And then a cluster of, say, New York, Connecticut, and Northern New Jersey, which is closer to New York. So Governor Wolf has been nothing but open and cooperative. I have no issues, and we're working together, and we'll have our input when it comes to whenever the economy opens again. And to tell you the truth, I have no idea when that's going to happen. And I think people are a little too overly optimistic. I mean, large gatherings of people at a sporting event at any time soon. And whether or not you can go to a restaurant. I mean, there's all kinds of different opportunities and different issues that come about. I'm confident we'll have our say, and we'll have the cooperation of Governor Wolf and the rest of the governors.
Thank you.
Okay, thank you, Paige. Next, we have Pat Loeb with KYW. Pat?
Thanks. My questions are for Brian. Now that you have negotiated new space, can you tell us like the overall dollar number that the city is spending on quarantine and isolation space?
Sure. So I haven't added it all up, but I'll give you the lease terms for each of the hotels. So for the Holiday Inn, it is $175,000 per month. For the Fairfield Inn, it's $119,000 per month. And for the Springfield Inn, it's $130,000 per month.
And what is the total number of rooms available with all three of them?
So again, I haven't added them up. At the Holiday Inn, it's 163 rooms. At the Fairfield, it's 119 rooms. And at the Springfield Inn, it's 130 rooms.
Okay. Yesterday, you said that there would be a site for people with profound behavioral health issues. But these two new sites, they're strictly for first responders. There are no homeless people, no.
So the Fairfield Inn, so depending on how the Holiday Inn progresses, the Fairfield Inn may convert into a general population site at some point. We're far from that at this point. We're far from opening up the Springfield Inn. For those who are with severe challenges and special needs. We've identified an alternate site, and once we have wraparound services identified, I'll certainly be talking about that in more detail. But we still need a provider to provide wraparound services, so we're not quite there to open up that site.
Okay, thank you. And then I just would also like the citation information.
Sure.
If you can, thank you.
Okay, thank you, Pat. Now we are going to go to Max Marin with Billy Penn. Max?
Hi, thanks everybody. This question's for Dr. Farley. Do we have any updates on the number of coronavirus-related deaths that have occurred in long-term care facilities, nursing homes? And are you tracking how many places have at least one confirmed case? What does that process look like?
We have, I think I gave the number earlier, exactly half of our deaths have occurred in long-term care facilities. I use the term nursing home, but long-term care facilities is probably more accurate. And I don't have a number for you right now about how many of those facilities have at least one case.
The total number of cases, though, just to clarify, not just deaths?
Oh, the total number of cases. I don't know that we have a good number for that because we don't have full reporting on how many of those are from long-term care facilities.
All right. Thank you so much, Doctor.
Okay, thank you, Max. We're now going to go to Manny Smith with CBS 3. Manny?
Thank you very much. A few questions from our team today. Looks like Senate Bill 613 is being hotly debated again in the State House. I wanted to ask the mayor his reaction to that, and is he concerned that businesses could be forced to reopen too early?
I don't understand the motives behind the bill. I can't speak to their motives. It's mostly a Republican-led effort. I believe that the governor will not stand for that and use whatever power he has to keep that from happening. The problem here is that from the White House and now from the State House, this race to open put us back significantly in August or September and maybe double what we're dealing with now. So I think the most important thing is to follow the science and listen to the doctors and don't do anything that's stupid. And don't open too soon because we could wind up in worse situation than we are now.
We wanted to see if Dr. Farley had a reaction to that too, from a health perspective. Is he also concerned about the impact this legislation could have?
I'm very concerned. Yeah, give you an idea. New York City has a mortality rate from this infection 10 times that of Philadelphia. It gives you a sense for if we had stayed open just a couple more weeks, we might be like New York City, have 10 times the number of people who died. And if we were to reopen too soon, we might see a surge just like that again. We don't want to be like that. So we are going to follow the data as much as we can. And when we'll open, I think we should open only when it's safe, and we open in a safe way so that however we open, we're minimizing the risk of viral spread, and we have good systems in place to monitor, to identify it if the virus starts picking up speed again, so that we could reinstitute those controls quickly if that were to happen.
We had our last question is about SEPTA. Once again, we had some reporting this morning. SEPTA is now providing at least a limited supply of PPE to public transit riders. And as they get on buses and trains, wanted to know if you guys were aware of that as an administration, and did you encourage them to do it, and do you support it?
Sure. So I did have a chance to talk to Leslie Richards, the general manager, yesterday afternoon, and she let us know what their intent was. And yes, I think it's an excellent idea. I think they also recognize that they're going to be run into some concerns around on the amount. They may not be able to continue to provide face masks continuously for a long period of time, but they wanted to try it, wanted to encourage their ridership to wear masks, and certainly support their efforts to keep all their riders and their employees safe.
All right. Thank you very much.
Okay, thank you, Manny. We're now moving to our second round, so last call for questions. Next, we have Brandon Hudson with NBC 10. Brandon?
Hey, what's going on, everybody? Thank you, Kelly. So can we get a little more insight on how things will work at the Leocore Center? Is this a place where people will be able to just walk up to and go use? Or is this a situation where you have to be assigned in some sort of capacity? Can we get a little bit more insight and walk us through on how things will work over there?
The Leocore Center is built to be a hospital, and it's built to be a hospital for patients with the coronavirus infection who have already been at other hospitals and are passed through the most serious phase of their illness. And they're getting better, but they're not better enough to go home yet. And so they may spend the last 3 or 4 days of their hospitalization at the Leocore Center to free up beds so those hospitals can deal with sicker patients. So no, it's not something for anyone to go up and walk up and be admitted to. It's something that only is going to happen from a communication from doctors at other hospitals who need to free up beds to doctors that are leading the Leocore Center.
Well, given the hospitals kind of reaching the limit, how soon will we see the Leocore Center being used?
The Leocore Center will be ready to receive patients tomorrow. Whether they will need to receive patients is really dependent on what happens in other hospitals across the city, whether they feel that they need that relief. They need to be able to open up those beds. So we may never need a Leocore Center, or we could be admitting patients as early as tomorrow.
We know that the workers are being outsourced that work at the Leocore Center. How's that being paid for?
I'm not sure what you mean by outsourced.
So workers are coming in not from the city. Is this are the people that work at the Leocore Center, are they being paid for out of the city's rainy day fund? Or I guess we just want to know who's working at the Leocore Center and how is the city paying for them?
So let me answer about the medical staff, and I'm going to turn over to Brian Abernathy to talk about the finances. So the medical staff there are going to be a combination of volunteers with Medical Reserve Corps and other physicians and nurses that are paid for through contract who are available and just providing that service for pay.
On the financing, at this point, the city is paying for that hospital to be stood up. We do expect most, if not all, of those expenses to be covered and reimbursed by the federal government going forward. But it's important for us to make sure that that gets up in a timely way to protect our healthcare system overall.
All right. Thank you, guys.
Okay, thank you, Brandon. Seeing no additional questions, we are going to conclude our daily briefing. Thank you all.
See you. Thanks.